So vaccine passports are becoming a global reality. Many countries require you show proof that you've had the COVID jab before they allow entry. A number of countries are imposing vaccine mandates on government workers as well. While it's a pragmatic way to considerably lower the risk of moving the vaccine around, it's also becoming a bit of a human rights hot potato. Some have compared it to forcing a person with HIV to show they're taking their HIV medication. Others calling it the new DOMPAS, fascist, and a system that will create division and stigma against those who choose not to vaccinate. Well, let's ask the Human Rights Commission if they foresee a human rights issue here. And I'm joined now by Chris Nissen of the SAHRC. Chris Nissen, thank you so much for joining us. So is denying someone entry into a country because they've chosen not to get the COVID jab a human rights issue?
Well, Sally and the viewers of eNCA, and thank you for inviting the Commission. First of all, let me say that the Commission do believe that, we will encourage everyone to vaccinate, because vaccination does at least prevent the loss of life on a large scale, and give a person a better chance to survive when they contract the virus. But you will recall that prior to the vaccination program, people were required when they travel to at least go and test and show a fact that you've tested for the virus and that you were either negative, and they would not allow you to travel. The problem that we have in this country, in South Africa, is that we're surrounded by neighboring countries which move in and out daily, on a daily basis in South Africa. For example, school children from Lesotho move in and out on a daily basis, and they go to school, and obviously Botswana as well, in other countries. So yes, the problem that we face in the world today, and in South Africa in particular, is that we've come through a process that sometimes people were forced to do things. You remember that many years ago, people were forced to be sterilized. HIV and AIDS women were forced to after giving birth, to be sterilized and so on. So we really look at the issue about forcing. And given the fact that our government has not really come out with a clear policy on what they need to do around the vaccination in terms of traveling, we know that if you travel into Africa, you have to have particularly those areas where there's malaria, that you have to have a yellow card and so on. So yes, there are some human rights issues around that, enforcing people to do certain things, because we will effectively, when we look at the level of vaccination in Africa, it's so low that you'll find out that we'll then have to keep out the rest of those people.
So, Commissioner, I want to break this down, because there's lots of different elements that I want to ask you about each of them. So if I want to go to another country for a holiday, such as Mauritius, and they say, well, you can't come in, you can come in, but you'll have to do the 2 weeks quarantine, or you can get vaccinated and come in. Is that a violation of your human rights in any way, yes or no?
No, listen.
No, it's
sorry,
not.
Sorry, Sally.
Yes.
No. When you go for a holiday, you take all precautions to go on a holiday, including taking out insurance so that when you travel.
Yeah.
But I think when you start forcing people to say you cannot come into this country unless you have, like we've seen today in South Africa, where we hear that there are some directives and people cannot come to workplace because you must be vaccinated, when there's no clear policy and no clear law on determining those issues. I still believe that, yes, if you travel, that you need to make the necessary arrangements, and those arrangements include, when you travel into some countries, to take the yellow fever injection.
So, travelling across our borders is one thing. I think that one of the reasons people are getting very angry, I mean, you made the point very well about we've got a history of people being denied their human rights and being forced to do things they don't want to. So it upsets a lot of people in principle. But some of the comparisons that people are making, some say it's the same as asking someone with HIV to prove that they're on their medication. It's just like the DOMPAS. They're comparing it to Nazi-style tactics. I mean, is this an overreaction, or do they have a point in your view?
I think they do have a point. because you see, all countries, when this virus broke out and when we started traveling, you know, at the different levels, people were allowed to travel, but because of precautions, they were asked to quarantine for 14 days. I mean, you know, it was, some people found it very unacceptable, but I thought that was a good way of saying, come into our country, but please can you take the necessary precautions? And if you are here, can you spend 14 days? And many people, expats and so on, that came into the country, that and the other countries, they had to spend 14 days. So I think it's important that we make a distinction between like forcing people and asking people to take the necessary precautions.
Yeah, and I want to move more to what goes on within the country domestically, because, for example, you know, we might get to a point of vaccine mandates for all government workers, for example, as we've seen in the United States. But if we look at our Bill of Rights, we compare our Bill of Rights to what a vaccine passport might ask. And I'm talking about a vaccine passport which might give you the right to get a job, give you the right to get into a football stadium, give you the right to go to a music concert. Our freedom of movement is enshrined under our Bill of Rights: equality, human dignity, and this one, freedom of religion, belief, and opinion. And it's that opinion that I think is the interesting sticking point, because if someone believes, for whatever reason, even though not based on science, even though we know the vaccines are safe, their opinion seems to trump the right of the nation as a whole, the good of the people as a whole, or does it?
Well, I'm vaccinated. My family's vaccinated. We'll encourage people to vaccinate. But we also believe people have got their rights and their opinions from religious or whatever beliefs. At the same time, we know that we have to be responsible, because with rights comes responsibility. And that responsibility includes that I do not infringe on the rights of other people. However, we cannot have a government or any government saying, thou shalt be vaccinated. We lack a campaign that's effectively ensuring that we debunk the myth around vaccinations, debunk the myth around what vaccinations does. They're saying that you will die afterwards. And today, I think on the SAFM had a very beautiful show on saying, when somebody said, well, my brother died after being vaccinated, and she asked him, does the death certificate says that he died after vaccinated? Because there's so many other reasons why people die in this country. Cancer is, in fact, one of the biggest killers in our country at the moment. So, yes, we need to respect people's rights. We need to respect people's opinion. I respect people when they say, I cannot give blood because then I cannot receive blood because my religion says something like that. And the Constitution guarantees that, you know, and law doesn't change people's behavior. It is trying to influence people and trying to encourage people, to show people the benefit of it.
So what I'm hearing you saying is that government would have a hard time, but we also know, imposing a mandate, but we also know that certain workplaces are considering it. You know, we've seen Discovery, Sasol, saying, well, you need to be vaccinated unless you have a really good reason, which seems on the surface of it to go against what the Bill of Rights enshrines, which basically says, well, you have a right to your opinion. And perhaps the point you raised about it being an issue of you're not going to be stopped. You just will have to undergo other things to check that you're safe in this group setting, such as more regular testing, etc., etc. I think the concern, though, is that this debate has the power to polarize people. There's concern that people who don't believe in vaccinations, which is their right, even though, you know, they're wrong, but it is their right to believe that, that it is going to lead to society being polarized and a lot of stigma creeping in. How concerned are you that we are going to see that?
From the very beginning, when the COVID-19 hit our shores, we saw that, you know, that whilst we encourage people to keep social distance, to sanitize, wash your hands, and then later on wear your mask, we encourage people to do that. The inequality of this country has shown up that, that not all people have got access, cannot keep distance, that have access to water. And so we are saying that, yes, we must encourage people to be vaccinated. We must ensure that we create the environment for people to understand why it's important to be vaccinated. But we cannot force people. We cannot say to people, you have to do that. Whilst we believe that we need to make sure that people obviously, get to the point of where we have a guidance government. Even the Department of Labor have given directives on the safety and health occupation regulations and act of theirs. We have seen over the years in workplace that regulations haven't been adhered to. People have been poisoned, people have been suffocating, working under unhealthy and unsafe conditions within the environment in workplaces, and we've seen that act has not fully been implemented. So even if you implement that act today, it will take a lot of effort and a lot of time. However, we do believe that people have to go and vaccinate so that they can show and protect themselves and protect the others around them. But forcing people, in my personal opinion, is we're going back to the old style.
I think the issue is not necessarily forcing, but people who don't want to vaccinate may feel that their freedoms become so curtailed, they feel almost forced. Could that be an issue?
It certainly is an issue. It certainly, and you've seen over the years, Sally, you remember, I can't recall the exact date, where there was a court case in which a family of the Jehovah Witness, if I'm correct, where the child was given a blood transfusion, and it was a massive issue in our country. You remember that one. And so, we have to respect people's religious beliefs. We have to respect people's opinions. We have to respect people's cultural beliefs. And that's why the Bill of Rights is there. And that's why we've got institutions like Chapter 9, institutions like the CRL that have to protect the religious and linguistic rights of people. But at the same time, we do have in our mandate, we do have a part of our mandate in our act is to promote and create the culture of rights in the country of South Africa. Therefore, it is the responsibility of the South African Human Rights Commission to, at all times, in all places, continue to promote the rights of people and continue to promote, to say, vaccine is an important event in our country. We respect your rights and will defend your rights even if you disagree.
Thank you very much for chatting to us this evening. That was Human Rights Commissioner Nissen.